So, welcome, Dylan. I'm really looking forward to our conversation today.
Likewise, thank you so much for having me on.
Yeah, when I heard about Foodini, I thought what a perfect resource for our audience because we deal with so many people in our practice and through the podcast who have digestive issues, food sensitivities, intolerances. And I know you're somebody like that. So, do you want to maybe start by sharing what originally inspired you to create Foodini and what gaps you were seeing for people dealing with these issues?
Yeah, 100%. So, just for context, as people probably can hear, Irish accent, born in Philly, grew up in Ireland, and I was a corporate lawyer by trade prior to entering this world. But for me, it was being diagnosed as celiac when I was about 10. I'm sure many listeners can probably resonate. When we actually moved back from the States to Ireland, the symptoms first started showing. So there was a few years there between 5 and 10 where I was quite sick all the time, couldn't figure out what was wrong with me, etc., etc. And then finally, someone recommended we get tested for that. And you can imagine 20 odd years ago in rural Ireland, celiac and gluten weren't even words in the dictionary at that point in time. So thankfully, once got the test confirmed, that was the case. And since then, the challenge has been navigating, in particular, dining out of home with a gluten-free diet. And I just was getting more and more frustrated over time as to how little information restaurants and food service venues were giving, how many mistakes they were making, just the complete lack of transparency. And then the more I dug into just how many people were impacted by this problem, like 33 million Americans with an allergy alone before you go to intolerances and lifestyle diets, it just, for me, was too big a group of people who had a real problem that needed to be solved to be left in the state it was. And yeah, I think that was the trigger moment for deciding to do something about it.
Yeah, absolutely. And the problem is getting bigger and bigger as the world changes, right? Because I would imagine 20 years ago, well, first of all, like you said, it was like no one even heard of it. I know in my original training as a dietitian over 20 years ago, I think there was like a paragraph on it in one textbook on celiac disease. And then, of course, we have more and more food intolerances and food sensitivities and food allergies. So it's just getting bigger and bigger, right?
The data is very black and white, like year on year. It just continues to grow in prevalence. And there's a number of reasons for that. Like some is awareness, some is there was 20 odd years ago, people were probably just like 50 years ago, I have a pain in my stomach, I get on with my day. There wasn't necessarily a mechanism or an awareness around what could be causing that. I think diagnosis is much easier now as well. Obviously, there are a much broader access to nutritionists, dietitians, medical practitioners who can get you the tests you need to figure out what might be causing the symptoms that you have. And then, yeah, just genetics as well, I think comes into play. Like, it's really interesting when you analyze the data of like prevalence around the world. Italy has the highest rate of celiac disease per head of capita in the world. Ireland is number two. Melbourne is the food allergy capital of the world if you take allergies broadly. The Asian population, I think 2/3 of the Asian population are lactose intolerant. So there's definitely as well different genetic reasons why certain people have certain allergies or intolerances. But yeah, the one thing that's without question is that it's growing in prevalence year on year.
Yeah. And we could do a whole separate episode as to why, right? But on the other hand, so we have the prevalence growing, and then we also have food changing, right? How people are eating and how many more restaurants there are in processed foods and how people are eating out more. So that's way more complex than maybe decades ago, right?
Yeah, exactly. Like you look at convenience now, and especially like younger population, just so you look at the earning reports for DoorDash or Uber Eats or those guys, it's like convenience, getting online orders, all that stuff has blown up, in particular post COVID. Obviously, that really, I think, gave those orgs a massive boost. But yeah, consumers dining out more, they're ordering online more, and they have more of an expectation around convenience, around personalization, and around transparency, which again, these are just consumer trends and patterns that exist outside of the world of allergies and health.
Hmm. And I had heard about like we're starting to gain more tools as the technology is just accelerating. And I had heard about some great apps to help with grocery shopping. There are some that have come out that will help you to put in your allergies and then help you find grocery products. But what I hear over and over again from clients is what about restaurants? And I just shrug and say, well, there's nothing like that. Unfortunately, that is the hardest part about having food allergies. And that's where you come in, right? So can you talk maybe more about why is it harder to do this with restaurants?
Yeah, 100%. And I think I was the same. That was my lived experience. I was like, eating outside of my own kitchen is a nightmare. Like, how can I just figure out how to navigate this seeming minefield? So, to take your points in order, you're right. There are some apps out there that have been doing groceries for a while. The reason why that is easier is because every prepackaged good has to have a nutritional label. And on the nutritional label, it has to have all the sub ingredients and it has to have the major 9 allergen information as well. So obviously it can be time consuming to do it manually, but you can get the information generally from something you buy in the grocery store if you take your time and understand how to go about that. So that's, I would say, been solved for. Restaurants, the problem is you walk in and you have a menu and what? You don't typically have the breakdown of every ingredient in that menu item. You certainly don't have the product data. You don't have the allergen and dietary data. For the most part, there are obviously a few outlier, bigger brands that have published an allergen matrix online. But point being, it's extremely difficult to get. And you're typically faced with a member of staff who, unless it's a really high-end fine dining restaurant, isn't trained on allergens, hasn't been equipped to answer these questions in any kind of a way that you could put your faith in, especially if it's like an anaphylactic life or death type allergen situation. So on the flip side, I do want to caveat by saying I have a lot of empathy for the restaurant industry in terms of they're not doing this necessarily on purpose. You know, they didn't just decide, you know what, screw the consumer, I don't want to give them this information. Typically, it's because the data just doesn't exist or the technology hasn't been there to equip them to give this information to the consumer. And so what we kind of solve for is we bring in all this fragmented data. We pull in menus, we pull in recipes, we pull in products. We're linked into distributors, so we get all the exact product data. We analyze all of that, and we have a team of dietitians who do that exercise. And then we power a personalized ordering or menu experience for the consumer on the front end. So when they walk into a restaurant or they go onto a restaurant's website, they can scan a QR or click a button on that website, create a dietary profile straight away. So they don't have to download an app. It's a web app experience. We have 150 different allergens and diets they can choose from. So not just the major 9, low FODMAP, keto, onion, garlic, whatever it is that you need. And they take gluten, vegan, low FODMAP, save, and instantly will say, here's what you can eat. Here's what you can eat with a modifier and what that modifier is. And here's what you can't eat and why, because it has X, Y, and Z baked into it. So we essentially provide a personalized menu experience, providing full transparency as to what is in that dish. And yeah, that's what our solution does. It solves for that eating out problem.
That's amazing. So let's just break down what you just explained, because what you're saying is you have developed a technology or a way to organize restaurant menus so that you can walk in, indicate through an app, I think, what your dietary restrictions are and be able to see which menu items are appropriate for you, right?
Yes. Yeah. In summary, yes. Just to clarify, they don't have to download an app. You can download our app, but you can also do it just without needing to download anything or give an email or anything like that. It's literally 2 clicks to get from scan QR to end personalized menu on your device. So we've streamlined that process. But I think just to help the listeners understand why it's so difficult to do this, it's because the restaurants have all these different systems. They have their POS system where they take orders through. The bigger groups have an inventory system where they have all their recipes so that the chef knows how to put this much of this and this much of that, so on and so forth. Then they order their products from another suite of technologies, which is more what we call inventory. And that's coming from like a Cisco or a US Foods or whatnot. So the data that is required to allergen information is fragmented and broken in all these different places. And there's been nothing before to tie it together to be able to have an accurate source of truth when it comes to allergies. And there are things that happen in supply chain. Cisco runs out of the mayo that they've been delivering to them for the last 5 years, and so gives another brand of mayo as a direct substitution. But that brand of mayo has a different allergen makeup to the prior one. So there are all these little weird edge cases that can happen. And because this has been dealt with manually and there hasn't been technology plugged into all these systems, it's why there's so many errors happening. And so we're really taking like a tech forward approach, plugging into all of these systems so that the data can speak to each other in live time and just try and keep as accurate a source of truth as possible to allow consumers to make an informed decision based on their allergies.
And that's a huge undertaking. Does it use AI technology? Is that helping with
Yeah,
this advancement?
started without, like day one, we were doing this completely manually, which stood to us because we learned so much about the reality of literally rolling up our sleeves and going into kitchens and taking stuff out of fridges of independent restaurants we were working with. Like, we did this the hard way at the start, but 100%, like, we spent a lot of the last 2 years training AI and large language models on dietary data so that it can do a lot of the admin data entry and initial data analysis. But what we've also trained it to make sure is that sometimes AI, if there's any tech people listening, can hallucinate, meaning it will guess. We can't guess. So we've trained it, anytime it's not 100% certain, it creates a flag or a ticket on our back end for our dietitian team to review manually. And obviously on most onboardings, there's a chunk of those tickets because we always find gaps in what we're sent. So it's the mix of AI plus human dietitian in the loop that makes this possible. One without the other would not be a scalable business that would do what it needs to do.
Absolutely, because food allergies are serious business, right? You can't have mistakes.
No guessing. There's no
Yeah.
guessing. Yeah.
And from the restaurant side, have the restaurants you've approached been pretty open to this? What's the reaction you've been getting?
Yeah, I would say yes and no. Like, there are definitely big differences between how, some restaurant groups are tech forward, consumer focused. They want to provide an experience there that's really good for the consumer. They want to make sure their consumers are safe and included and don't feel like they're a problem diner. There are other groups who care less about that stuff. I would say, though, to be fair, it's a minority that care less. I think what can happen is sometimes the restaurant industry has had a tough few years and there are so many fires they're trying to put out, just keeping open in the morning, getting staff into work, putting food on the table. There's 100 other things these companies are trying to do before allergies is even mentioned, right? So it can sometimes be an afterthought. But what we've tried to educate restaurants on is, like, this is such a risk for your business. Like, all it takes is that 16-year-old casual staff member to forget that there's sesame in the hummus and serve that to consumer. Next thing, they're on the ground and you have a real problem on your hands, both in terms of lawsuit, both in terms of brand damage, in terms of a number of different components. So we try and help them understand that this is a really important issue to mitigate from a risk perspective. We try and help them understand that this is only going to continue to increase. And do you really want your staff to continue to be the bridge in terms of this communication? Or do you want a central source of truth that the consumer can access themselves and not have to be constantly asking staff question all day, every day? And then there's also the fact that consumers won't go, and any of your listeners with an allergy will know this, you don't go somewhere if you don't know there's something there to eat for you. So if you go onto the website and you can't see the gluten-free or the nut-free option clearly, you're probably not going to go. So now not only has the restaurant lost you, but they've also lost your friends, your family, your co-workers, blah, blah, blah. And when we do go to a restaurant and we have a good experience, we're the most loyal consumer that a restaurant can have. We keep going back again and again and again to the same places that make us feel safe. And then there's the last point there that's more recent is regulation. So 13th of October, I think, in California, Gavin Newsom signed the first ever law as relates to food allergies in restaurants. And so now from next July 1, for the first time ever, every restaurant group with 20 plus locations where they have at least one location in California will be required to publish top 9 allergen information on all of their menus. And that's a huge step change for the allergy community generally in this country. I can talk in a minute more to like momentum and different things like that across other states and federally, but moral of the story being it's a real step forward towards making this not a choice for restaurants anymore and making it be like Europe has been for the last decade, where you can't open a hot dog stand without labeling for the major 14 allergens as it is over there. Finally, regulation has come here, and I think it's going to be a big step change for the allergy community here.
Absolutely. So we've had that regulation for the top 7 for packaged products, right? But you're saying this is going into effect July 1st, 2026 for restaurants?
Yep. I think up until the 11th hour, it was all restaurants in California. At the last hurdle, it was shifted to 20 plus locations with, I think, sensible in some ways in terms of if for the first time this being rolling out, let's do it with the chains who have the easier access to the data to be able to do this. Like independents can absolutely do this. It's probably just a little bit harder for them. But yeah, every one of those chains, which essentially is every national enterprise and mid-market chain, if will have to now publish this and not just bury it in their website, it actually has to be present on their menu physically and digitally. So again, not only I think does it help protect the consumer, but it just even culturally helps industry realize that like this is serious. You can't keep brushing this under the carpet and hoping that you're just not going to hurt someone in your venues. You need to take this seriously. You need to have processes in place or systems in place to make sure that the information is accurate, or now I suppose there will be consequences if they don't do that correctly. So I think that's important.
Absolutely. I mean, how many of us can relate to going to a restaurant and, like you said, the 16-year-old waiter or whatever, you ask a question and just not feeling like secure in the answer that you're given. Yeah. So I think this is amazing to give peace of mind to all of us. Like you said, it's so important. And so what ends up happening is people just don't eat out. They get stuck at home. And that has such an impact, tremendous impact socially, quality of life, mood, mental health. It affects so many areas because eating is such an important part of being social and
Couldn't agree
life
more.
and
Couldn't agree more.
travel.
Yeah, it can be so hindering. So hindering. And every one of those examples you just gave, I think it is so accurate and so unnecessary. Like where I'm lucky as a celiac is like if I accidentally get the wrong thing, I'll be sick for a few days, but I'm not going to die, right? You take the anaphylactic community, which is sizable in terms of out of that 33 million, like that is life and death for them. And if I'm the mother of a kid with food allergies and they're going into their teenage years and starting to do all those things that you just mentioned that teenagers want to do, go out, socialize, it's such a worry and it's such a risk. And it's so avoidable if there was just more transparency into what is going into food. And again, the US unfortunately has just been behind Europe on this. As I mentioned, this has been standard for 10 years over there. But with this transparency that is coming through regulation, I think that the consumer outside of California now is going to continue to demand this. I think it's just it's shifted from being a want to a need. It's shifted from being something that you'd ask for versus now you expect it. And the other piece of the puzzle, which is not allergies and something you alluded to earlier as well, is just healthy eating. Like look at the food as medicine movement. Look at the Function Healths and the superpowers of the world who are now giving you information on your microbiome and your gut health to help inform what foods you should be eating more of and less of. Like people are getting more and more and more health conscious, as they should be, to be frank, because so much of the food here is, in my opinion, low quality. And we don't need to talk about ultra processed and all that stuff, but the consumer is expecting more and more and more to understand transparently what they're putting into their body, whether that's for allergy reasons or whether that's just generally health and wellness issues. And so I think that the food industry is finally realizing and understanding that, and regulation obviously is pushing them along. But I think that the next few years, we're going to see a world that is much easier for the food allergy community to be able to navigate in the same way that so many people take for granted every day who don't have these food restrictions.
Mm-hmm. Yeah, that's an excellent point. I think it's even becoming more mainstream to talk about this stuff. We're not talking about a small segment of the health conscious population anymore. It really is becoming more widespread. And so in addition to the liability that you're talking about, the broader responsibility of restaurants, I think you shared with me in our previous conversation too that it also can help the restaurant's profitability.
100%. Yeah. So for a few reasons. One, you've nearly half the population who falls into the bucket of having these dietary restrictions. As I said, if they don't publish information to the consumer to make them understand that they can go to their restaurant and have options for them, they're not going to go. So not only is it a revenue loss just by default, but it's such a revenue opportunity today for any restaurant groups who decide to proactively make sure that consumers can get this information, regulation or no regulation. And so there's that. And then, as I mentioned with the veto vote, most people don't dine alone. So if you convince me to go to your restaurant, well, now I'm bringing people with me. So that's a huge revenue potential. Also, typically, and this is not necessarily something I'm delighted with, but our basket cart sizes are typically bigger as well than the average consumer. I need to get the gluten-free pizza base or the gluten-free pasta or the gluten-free bread, and that's always a plus $2, $3, $5 on top as well, unfortunately for me, but I'm willing to pay it to be able to eat in the restaurant with my friends or family or whoever. So yeah, a lot of dollar reasons why this is good for restaurants and food service orgs. So it's not just restaurants, it's hotels, stadiums, it's events, it's any place food is served. This same problem is prevalent and the same opportunity exists.
Oh, okay. So this extends to those other types of food service establishments like college campuses. What about healthcare, healthcare?
Yeah, we can work with any place or type of place that serves food. The only difference is that in the back end, it tends to be different systems. So like, for example, we've done less in healthcare and aged care so far because they use different technology stacks to manage their data, and they're a little harder is the wrong word, a little more involved to integrate in with. And so from just a prioritization as a company standpoint, we haven't got there yet, but we will. And so ultimately, to your point, this isn't just about when you go out to restaurants being able to understand. This is when you go to the ballpark. This is when you go on an airplane. This is when you go on a cruise ship. This is when you get catered food to your house for your kid's birthday party. This information is required at all of those touch points, and that's what we're driving towards.
Okay. Yeah, and this is really the perfect time for it all to come together, isn't it? So it's a big deal. It's very exciting. So I guess my first understanding was that Foodini is an app, but you're saying it's more of a back-end technology that plugs in to different restaurants, like websites?
So a few different things. We have a back end that powers and gets all the data. That's what we have directly with restaurants in the back end to make sure we have accurate information. So let's put that to one side. From a consumer standpoint, we have two things. We have an app and we have a web app. If you walk into a restaurant that we have in New York City, you will see a QR code saying Allergies dietary needs, scan here. They'll scan that QR code and it will pop up a website, www. And that is our experience. Create dietary profile, gluten-free save, menu personalized to you straight away. So you can access it as simple as through a website like that. Alternatively, we also have an app. So you can opt to download the app to see that same information. And we also, in the app, have discovery functionality, but only currently in LA, where it's in beta. So what we're trying to do is, as we sign on all these restaurant partners and we have their information, we're listing them in our app as well, so that consumers who are gluten-free, who are using our app, can discover other restaurants that have gone through our process and that have accurate allergen information, so that they can find other places to eat, not just the place where they originally discovered us, if that makes sense. So it's twofold, but we're not shouting about the app from the rooftops across the country yet, because we don't have options in every city in the country as yet. We're trying to roll out gradually. But for anyone who's listening who is curious about like, oh, well, what does a personalized menu experience look like? Or what will this look like when it gets to my city? You can download the Foodini app on the app stores and check that out. And we always love getting feedback from people on the experience anyway. And yeah, if you do live in LA, then you're in a better place to experience in real time and with your local restaurants what our experience looks like.
Okay. So the Foodini, that's as far as the discovery feature, but you do have relationships with larger national chains that have locations all over.
We do. Yeah. So you could open it up in your location. There could be a few around you. It's more just that, like, we like to have a bigger cohort of restaurants in an area before we push people to look, because if you only have 3 things around you, that's not really a great experience. You need to have 100 options around you for it to actually be valuable. And so that's again why, from an internal prioritization standpoint, we're focused more right now on making sure that as many restaurants as possible across the country have the technology in their restaurant and on their website. And then as we continue to grow, we'll publish more and more of them on our app and allow people in cities across the country to discover new places to dine out as well as just their local spots.
Okay. So as it is now, you might go to your favorite restaurant and see that QR code scanner and be able to use it.
Or their website. So typically restaurants will in the menu section have allergy dietary menu button, and that powers our experience as well. So restaurant physically, restaurant digitally, and then separately our app where they can also discover other restaurants.
Okay. All right. Great. And so what would be your recommendation or your ask of the listeners? Like, what are you hoping people will look out for, or is there a way they can help?
Yeah, a few things. I think if I go helicopter view for a moment, I think regulation has proven to be the mechanism to speed up and improve the quality of life for people with allergies and who care about understanding what's in food. The California regulating, I worked with the co-sponsors and the senators team here on the ground to help make sure that got across the line. And that was a huge undertaking. And it took a lot of people, a lot of heavy lifting and work and advocacy and reaching out to senators and assembly members and whatnot to make sure that got over the line. California typically is the blueprint, or often is the blueprint for other states and even at a federal level. And so the first thing I would say to people is your advocacy in terms of driving positive change forward matters, whatever state you're in and listening to this from. I know New York already has a bill in progress that is similar to what passed in California. I know some other states are gearing up to begin to move in this direction. And whatever your politics, RFK has 3 kids with peanut allergies and is making food allergies a priority issue. So there is momentum in the space. And I think it's important that we continue to push this forward and capitalize on it while it's topical for the betterment of the entire allergy food conscious community. That's number 1. So that's just encouraging folks in that regard. 2 is if you know a restaurateur or know a local restaurant manager or owner, we love to speak to brands who want to work with us. We're pretty seamless, we're not expensive, and ultimately we provide a service that really helps their community and them manage what is a sticky problem or traditionally has been a sticky problem. So that's number 2. Any referrals in that regard help a lot. And then number 3 is, as I mentioned on the app, always encourage people to check out the experience. We have been doing this for a few years, but there's always room for improvement. We're constantly adding new allergens and diets based on feedback from the community. I think we're at about 150 now. We started with 10. So community matters and feedback matters. And so if people want to check our app and play with it and understand how we go about it and have any feedback, good or bad, around how they would like to experience this kind of personalized information, check out the app and feel free to reach out to me directly. You can get me on LinkedIn, and you can also get us through our website, which is foodini.co, or on socials, which I'm sure we'll share as well as part of this.
Yeah, awesome. And I think one other thing you had shared with me, which I think is important to mention because I found it really interesting, was just the difference of this versus, because there are some apps out there about finding a restaurant that has gluten-free, but those are mostly based on people's recommendations, right? Not actual data.
Yeah, I've used them before as well. They're helpful. I don't want to criticize other platforms. They're definitely helpful in terms of pointing you in the right direction. It's kind of like Yelp for gluten-free or Yelp for food allergies, right? People leave reviews on venues based on their experience. But to your point, your experience and my experience can be 2 very different things. You could go last week and have a certain server who was trained and not trained this week. The menu can change day to day, not of mine week to week, not of mine month to month. And so unless you have a direct relationship with the restaurant and the menu data, you have no real way of actually knowing what's in the food. And the peer reviews and the referrals from the community are certainly a point in the right direction, but they fall well short of actually helping solve the problem of getting that transparency into what's in the food. And I think we just consider ourselves taking it to the next level in that regard, and then love having reviews over the top of what we do, but you need the menu data to be able to do this properly. And that's what we've been really focused on.
Yeah, and it's such a tremendous need because those of us in this space, we know how complex these issues like diets can be with all the ingredients to watch out for. I mean, it's way too much to expect the cook or the waiter to be able to navigate, especially like you said, say they ran out of something, they have to substitute an ingredient or whatever. But to have more regulation behind it really needs to happen because this area, it gets pretty detailed and it's definitely beyond the scope of just somebody who's trying to serve tables at a restaurant.
Yeah, and I think you touch on actually a very important point there, which I just want to point out, which is the reality for anyone listening who has any form of food allergy or medical need that requires them to avoid certain foods is there are no guarantees. Anytime you do eat out and someone else prepares your food in a different environment, you are taking a risk. There is no question mark on that. So the question becomes, how can you get as much information and take the right steps to mitigate that risk as much as possible? And that includes going to places that you understand, you take this seriously, going to places that staff have been trained on food allergies, going to places that publish allergy information so that straight away they've at least taken the time to try to do their best, being your own advocate and making sure that you tell them that you follow the process, that if you get that feeling in your gut because they said, I think that's gluten-free, don't just gamble, that you insist on asking for a manager, asking for the chef, because again, more times than not when it's an I think, it's literally an I haven't a clue. And ultimately, it all comes down to your own level of risk. There are people who can't have as much of a trace of a crumb of something or they're sick. And there are other people who they can live with a little bit of cross contact and their intolerance, it doesn't really trigger them at all. But how can you get as much information as possible to make an informed decision for you and your needs and your body and based on your risk appetite? But there are never guarantees, unfortunately. And I think everyone needs to always understand that reality.
Yeah, that's helpful to point out because this is bringing so much more data and regulation to the situation, but we can't control what's happening outside of our line of sight and as these meals are being assembled. So we never know for sure.
Exactly.
What has been the initial feedback you've been getting either from the app or just from the restaurant changes in general?
Extremely positive. For consumers, it's a personalized experience, which has become their expectation, whether it's on Netflix or on DoorDash or whatever. Consumers expect you to understand them and to personalize experiences towards them. So massively positive in terms of that. And also for the first time, they're getting this accurate data into their fingertips as well to enable them to make that informed decision for themselves. So overwhelmingly positive on the consumer side. And on the restaurant side, again, the hardest part has just been educating them on why this is important. But once we're in and established, we provide them so many benefits, from revenue to operational efficiencies to risk mitigation and reduction to the data we can tell them about their customers and how they can optimize their menu towards them. That, again, extremely positive. So it's just a matter of, sometimes it takes a little bit of time for an industry to understand the importance of new technologies, especially when there's so many other fires they're trying to put out. But no, it's been really exciting and really positive, and that's why I'm so energized for 2026.
Yeah, it's going to be a big year for you.
Yeah, this time into 1 July in particular, where so many groups now have to do this, whether they like it or not, obviously provides us as a company an opportunity to work with a lot of these brands. And so that's probably our main focus, is to work with as many of them as we can, and then obviously continue to deal with any restaurant, small or big, or food service outlet around the country that sees the value in what we do.
Yeah. Well, thank you so much. I guess as far as parting words for somebody listening today who's afraid to eat out because of unpredictable symptoms, or maybe they have IBS or histamine issues or food allergies, what would you want them to know about what's becoming possible?
Yeah, I think I want them to know that one of the main reasons we exist is I don't believe that you should have an inferior life experience because you have a food allergy or food restriction of some description. I believe you should be able to go out, same as everyone else, order food and enjoy all of those experiences that, food as a fabric of life provides from a social setting. And I think that has been really challenging over the last number of decades. But I think finally we're at an inflection point where things are really changing, regulatory wise, consumer demand wise, food industry wise, and the technology is now there to enable this as well. And so I'm going to continue to work hard to try and bring that experience to everyone, as are other advocates doing other things in this area as well. It's a lot more than just me. But I think the future is a lot brighter now for this community than it was a few years ago. And I'm excited for the positive change that will bring.
I'm excited too. So keep us posted, and I'm really looking forward to seeing how this develops.
Really appreciate it. And thanks again so much for having me on. Really enjoyed the chat.
You're welcome.